What do we do at Georgetown University? Let me just talk for a minute about the Center for Children and Families. I've been at Georgetown now for about 7 or 8 years, and before that I worked at Families USA, which is a consumer health group doing lobbying on healthcare issues. And I wanted to kind of take a step back from the fray and think about some of these broader questions. But having said that, we're a super active and engaged policy center. We work with grantees around the country. We have some funding from the Packard Foundation for a project called the Finish Line Project, where we have 8 states we're working in pretty intensively to try to get coverage for all children in those states. And I think the idea from the Packard Foundation behind the project was that states were really where the action was. They were moving forward. At the time during the Bush administration, we weren't seeing a lot of action on the federal level. And so let's use this opportunity to have states kind of lead us forward and show the way. And interestingly, being here in Chicago, Illinois was really actually in the forefront, and we'll talk about that a little bit later. But of course now, as we'll talk about, things have changed, and there is a lot of action on the federal level. But before we get into that, let me just point out to you, I think there are copies of the presentation in the back if people wanted to pick it up at the end of the session. You see our website. We have a lot of resources on our website about covering children and families, particularly through public programs. It's really a lot of what we focus on, Medicaid and CHIP. And given the recent passage of the CHIP law, which we'll talk about, there's a lot of resources about summarizing what happened in that law. We have a handy-dandy summary. We have a longer summary. So all of those things are up on our website. Okay, so I thought I would start with just a little bit of an overview of where do we stand on kids coverage. This slide looks at the data for all children, not broken out by status. And you'll see that for the majority of kids, employers are their primary source of coverage, 55%. But Medicaid and other public programs is a very significant and has been a growing source of coverage for children, today covering about 29% of children. The uninsurance rate of 11%, children are actually doing better than low-income parents and adults, and that is because they have much more generous coverage through the Medicaid program primarily, but also through the CHIP program. So if you take the slide and look at the non-citizen kids coverage, you'll see that there's a much smaller percentage of kids who are covered through employers, about a little over a 20% drop, and similarly a much larger chunk of kids who are uninsured. And I was actually a little bit surprised when I pulled up this data that their coverage levels on Medicaid and other public programs was this high. 27%. So that's only a couple of percent below where the citizen kids are. So really where you're seeing the gap, the difference with the citizen kids is the lower rate of employer-sponsored coverage. And that's because immigrant families tend to work for employers that are not offering health coverage. They tend to be either smaller employers or employers if they're not authorized to be here or not offering them coverage. So there are a lot of reasons for that. And that's what I think you see as the largest discrepancy. So here, and again, these are probably familiar to most of you, the uninsured rate amongst Latino families is extremely high and really much higher for anybody else, relatively speaking. So you see here the uninsured rate for all children versus their ethnicity is on the right, and then their uninsurance rate is on the left. So you can see that Latino families are very disproportionately represented in that. So this, a lot of this data is from the Kaiser Commission on Medicaid, which I'm sure many of you are familiar with, but is a fantastic source of information on Medicaid and other public programs, as well as all, frankly, health insurance issues. They did a breakout, because we've had, probably many of you are familiar with, and we're going to talk more about, a 5-year bar in our public programs, so that if you were otherwise eligible for Medicaid and you were a legally present immigrant, you still had a 5-year bar that was enacted in 1996 as part of federal welfare reform law. So states could not get federal dollars for those folks. So they broke this down here to look at kids who had been in the country less than 5 years and for more than 5 years to look at public coverage. And public coverage could have been state-funded coverage as well, and we'll talk about that because some of the states stepped into the void. So you see lower levels of coverage for kids who are here less than 5 years. But again, it's actually not as stark as you might have anticipated. So kind of laying that out as the overview, let's talk a little bit more in depth about some of the public programs. And let me just start at the outset by saying that I have worked very closely and I'm not going to say exclusively, but almost exclusively on Medicaid for the last 16 years. And I still feel like I'm scratching the surface sometimes. It is enormously complicated. Every state is different, as you probably know. I come at this from the healthcare perspective. I am by no means an expert at all on immigration issues and law, and so that adds a whole nother dimension and complexity I think you all probably know more about than I do. But hopefully we'll have an opportunity in discussion to raise some questions and have some dialogue about the role of Medicaid and CHIP in your state and hear more from you about that. So just to say that I think certainly in the last couple of years, and this was true at the time it was first enacted, but the Children's Health Insurance Program has occupied a lot of the public debate. To the extent that Medicaid has been in the public debate, it's been more at the state level, as states have been grappling with their budgets and struggling to find ways to fund their Medicaid programs. But at the federal level, there's been an enormous debate about the Children's Health Insurance Program because we had a reauthorization bill that went through Congress. President Bush vetoed that bill twice, and as we'll talk about more in a minute, President Obama signed the bill as one of his first acts in office. So I think that people sometimes lose sight of the fact that Medicaid is actually the big player when you're talking about covering children. So here you see that the vast majority of kids who are getting public coverage are in the Medicaid program. Some states, their CHIP program is the same as their Medicaid program. It's all one program. Some states, it's a different program, but they sometimes kind of market them together. And in some states, they're quite separate. So there's a fair amount of variation there. But again, just to remember that it's really important to keep an eye on Medicaid, particularly, I think, for all of you as a potential source of funding. So what are some of the key differences in Medicaid versus CHIP? Well, Medicaid is an entitlement program, and CHIP is not, and that's obviously a very significant difference. This guarantees that if you're eligible for Medicaid and you meet the requirements, so basically the state can't turn you away. There are a lot of kids who are eligible but not enrolled in both Medicaid and CHIP, but if they show up at the door, the state has to enroll them. Now, there have been pretty significant changes in the CHIP program, and it used to be the case that there were a few states that had enrollment caps that sometimes shut their doors, but as a result of the new bill, there's a lot more money in CHIP. So we don't actually expect to see a shortfall of federal funding when it comes to CHIP. Now, there's issues about the state share on that side as well. But it's important to realize that there's a lot more money in CHIP now. So there's a lot of room for states to do better and to do more when it comes to covering kids, and particularly for immigrant kids, as we'll talk about in a minute. So CHIP typically layers kind of on top of your Medicaid program. Medicaid serves the lower income kids, and CHIP comes in and serves the higher income kids. And states have a choice whether they want to simply expand Medicaid, and that is their CHIP program, or they can set up a separate state program. So if they expand Medicaid, all of the same Medicaid rules apply with a couple of exceptions. And in Medicaid, there's a very rich benefits package, which is probably familiar to many of you, the EPSDT benefits package, which is a very comprehensive benefits package. And it allows Medicaid to fund things like mental health services in school-based settings and those kinds of things, which typically you're not going to find in a private insurance package or even in many of the CHIP programs, and that's why I think Medicaid is so important, particularly for this group. CHIP does not have that kind of broad benefits package. There are benchmarks in the statute that are pegged to private insurance packages, and so if a state has chosen to go the separate state program route, in other words, they didn't just expand Medicaid, then they may have a lesser benefits package. And the benefits package got a little bit better in the CHIP bill, but still it's definitely less comprehensive than EPSDT. The other significant difference is that in the Medicaid program, the cost-sharing protections are much tighter than in the CHIP program, and in particular for children. There's a few exceptions, but by and large, for the lowest income children, you really can't charge any cost-sharing at all.